Are you struggling with fluid and electrolytes? This video is for you because fluid and electrolyte are the most tested component in your nursing school and the NCLEX. They keep on showing up. How do you memorize them? I'll show you a trick how to recognize them, when to use this fluid, which condition, and by the end of this video, you master the mnemonic to be able to recognize signs and symptoms associated with each electrolyte and when to use this fluid. The first thing we'll talk about is sodium. Sodium level is about 135 to 145. Nowadays, in the NCLEX, they will give you, in the nursing school, probably they have to give you, if they give you a case study, sodium and balance is used for what? To control your blood pressure and fluid status. Therefore, I tell people, if you want to know sodium signs and symptoms, think about neurological and fluid. That's all. Don't worry about the other one. These are the most common things they will give you. And so the mnemonic means what? Sodium swells the brain. So it makes the brain swells up and causes edema. And therefore, when you think about sodium, think about neural and fluid balance. And this is the way to recognize it. Hyponatremia is going to swell the brain. So the swelling of the brain is associated with hyponatremia. What is the number one symptoms associated with this? Neural. So if you pick in an answer, confusion, seizures, and coma. The headache, hypotension, and hairy tongue is additional one. But if you pick in an answer, always go to the neural. Confusion, seizures, and coma, because the sodium swell the brain. Hypernatremia is the dehydration, the fluid status. You see, I said think neural and fluid status. The neural is the hyponatremia, and the fluid status is the hypernatremia. So when the sodium is too high, greater than 145, is a sign of dehydration. Therefore, what? Flushed skin, you have low-grade fever, you feel thirsty to drink, and your tongue is going to get dry. This is the mnemonic for sodium. What does the sodium do? It swells the brain. What are the signs and symptoms? Think neural and fluid status. If the sodium is low, think neural. If the sodium is high, think about your fluid status. Those are the mnemonic. Next one is potassium. The level is 3.5 to 5. Very, very important. What is the trick to remember potassium is this. Low potassium make you weak and slow. You slow down. If your potassium is high, you're going to go up, tight and overactive. Once again, low potassium, weak and slow. High potassium, tight and overreactive. What is the mnemonic? Potassium pumps the heart, right? This function is going to pump the heart. So you're thinking about slowing and tightening. That's all. Now, hypokalemia is what? Slow, right? Slow and weak. And therefore, the heart is going to be slow. You're going to have flattened T wave, and you're going to see prominent U wave. These are features on the NCLEX or nursing school. This is what they ask you. Which of these EKG changes is associated with hypokalemia? Once again, slow and low, right? Slow T wave inversion and prominent U wave. The other slow things you have to think about is muscle cramp. Constipation, you see, things are slow. Your reflexes go down. Things are slow. But when the potassium is high, you get tight and cranky, right? Therefore, if the T wave is flat in hypokalemia, it's going to be tall in hyperkalemia. If you have constipation in hypo, you're going to have diarrhea and your reflexes will go up. Once again, memory tricks. Low potassium, weak and slow. High potassium, tight and overactive. So what are the EKG changes? And you can see this is a normal EKG. This is the P wave, QRS, and T. Look at the T, it's smooth. Very, very smooth. But when your potassium is low, things go weaker and slow. So T wave become flattened. There's no T wave there. And the T wave will peak when you have hyperkalemia. And that's why you have this sign over here. So what you're looking for is what? T wave inversion or flattening wave in hypokalemia and a peak T wave in what? Hyperkalemia. This is another sign of that. On the EKG, you can see a peak T wave. So that's that for potassium. The next electrolyte to know about is calcium. The calcium level is 8.5 to 10.5. That's the normal. You find in bone, the kidney is responsible for absorption and the GI tract. The best way to memorize calcium, the mnemonic is what? When the calcium is low, you are going to be jumpy, excitable, and twitchy. When calcium is high, you slow down, right? It's opposite that of a potassium, sluggish and depressed. Therefore, the mnemonic, calcium calms you down. Therefore, if your calcium is high, it's going to calm you down. Your muscle and your nerve will calm down. Hypocalcemia, my calcium is low. Therefore, I'm going to be twitchy, excitable, and twitchy. So that is not calm. Trousseau and Chvostek signs. Those are signs because I'm jumpy and my calcium is too low. When your calcium is high, you're going to calm down. I'll calm down my muscle. I'll calm down my nerve. So I mourn, I groan, I bond, and I will do what? I have stones, kidney stones. These are signs and symptoms of hypocalcemia. And this is what the EKG look like. The EKG changes, you can see hypocalcemia and hypercalcemia is associated with QT prolongation. You can see the QT is prolonged in hypocalcemia and QT is shortened in hypercalcemia. Those are the tricks you're supposed to know and know it. Magnesium is the same as calcium. You don't have to memorize. If you forget, always go back to calcium. Magnesium and calcium do the same thing. Normal level, 1.5 to 2.5. What is that? Low level will make you jumpy, excitable, and twitchy. High level, I will slow it down. I will slow it down and get depressed. Therefore, mnemonic, magnesium mellow the muscle. The same thing, calcium mellow the muscle. But because this is M, I call it magnesium mellow the muscle instead of calcium calming down the muscles and the nerve. Hypomagnesium is slow for normal or high. Therefore, if you don't have magnesium, you're going to be wild, you're going to be jumpy, you're going to be excitable, you're going to be twitchy. That's why we have Torsades, right? Tremor, right? Tachycardia, reflexes is going to go up and you're going to have seizures. When your magnesium is low, it's different. This is Torsades. You see meandering changes in the ventricular wave. This is polymorphic ventricular tachycardia. You got to give the individual magnesium, and this is Torsades. If your magnesium is high, it will mellow you down. Your reflexes go down. You become bradycardic. You become lethargic. Your respiratory will go down. Therefore, if patient is on pre-eclamptic watch, basically getting magnesium to prevent eclampsia, you can see you got to monitor their respiratory rate, the reflexes, the heart rate, the urine output, because what? Magnesium make you mellow. It will make the pregnant lady mellow. The aspect is straightforward. Isotonic means I stay where you put me. I don't move and I go anywhere. So isotonic fluid will stay in your blood. It doesn't move. If it's going to stay in your blood, then we have to be using it for anything that is lost in the blood, dehydration, blood loss, or shock. And if it has to stay in your blood, is you have the same concentration as your blood, 29% normal saline and lactate trigger are the most common isotonic fluid. The next guy is hypotonic. They make you swell. It's like an hippo. They go inside the cell and make the cell swell. And so these fluid go inside the cell and they make the cells swell. So we use it in cellular dehydration. Anything less than 1% is a fair game, right? 0.45% normal saline, 2.5 dW, right? That's free water. D5W is different. If you're sitting there in the bottle, it's hypertonic. As soon as you start to infuse, it's isotonic. By the end of the infusion, it's hypotonic. So it's a little bit different. What you need to watch for, because you cause things to swell, it can go inside the brain and cause cerebral edema. So when somebody have a head injury, never give them hypotonic solution. Never give them hypotonic solution. Once again, that is the red flag. Next one is hypertonic, too high, right? They go outside the cell. So they leave, they cause the cell to do what? Shrink. So when the cell has shrink, it's small, right? Hypertonic people are usually skinny, make the skin, they leave the cell. These fluid leave the cell in the bloodstream. So if you want to push fluid out of something, you use what? Hypertonic. If I want to pull blood out of the brain, I will use hypertonic solution. So severe hyponatremia, like what? SIDH, or if I have brain injury, I can pull fluid. And the normal few of them is what? 3% and 5%. Be careful. D10W, we don't use it in brain, but it's hypertonic. D5NR, we don't use it in brain because it's the dextrosol, but it's still hypertonic. D5LR, they are all hypertonic. If you can use it for resuscitation, but best one to use for cerebral edema is 3%. Since they're pulling fluid from the brain, it put it in the intravascular system. All these fluid go to your lung, and they can cause lung problem, pulmonary edema. So you got to be careful. These are the fluids. These are the electrolytes to memorize them. You know what to do. Calcium and magnesium, when they high, what do? They slow you down. When they low, you become excitable. Potassium, when they're very high, what? They slow you down. When they're very low, you become jittery, excitable. If you think about sodium, think about neuro and dehydration. When you're high, you have dehydration. When you're low, think about neuro. And isotonic, I stay where I am. Hypotonic, I leaves. Hypertonic, I pull fluid out. This is the key to memorize all this. Thank you for watching. If you want to know more, the content will be linked to this video on fluid electrolyte. Take care of yourself and have a good day. Bye.